Is there, I mean, she can,
I'm gonna say. Because this is in webinar view, we're gonna, if you do have any questions, please feel free to drop them in the chat and we will go over those questions likely at the end of the webinar. Again, thank you for joining us. This is just an opportunity for us here at New Futures, for those of us that follow policy in different areas, to be able to update folks on what we're seeing this legislative session. It is a very busy year for a number of reasons. And we have, in some ways, somewhat unprecedented year, although we've been saying that word a lot, as far as the types of legislation that's been introduced and the number of them. So we will go through it. It is based in our policy area. So I'm going to start. I don't even know if I said my name. My name is Kate Fry. I'm the Vice President of Advocacy at New Futures. And I will walk through the bills at first. And for those of you who are new to New Futures, we are a nonprofit, nonpartisan health and wellness policy organization, and we work to advance bills that prioritize health and wellness in the state of New Hampshire. So I'm just going to start with our main campaign this year. It's called Campaign for a Healthy New Hampshire, and just a little bit of the overview of where we stand right now. I think, now approaching year 2 of the COVID-19 pandemic, it's certainly been a very interesting exercise in a number of different policies. And while the pandemic continues to devastate our communities and impact our families and businesses, there's a number of bills this year that would, we think, undermine public health infrastructure like never before. And so the hope of this campaign is really to protect our public health systems, those in the public health and healthcare system who are working so hard right now to get us out of this pandemic and to care for people who are sick and others who are trying to get back to normal. So through the campaign, we really hope to improve vaccine access. And I guess when I say improve it, we also don't want to go backwards in vaccine access. So, but we really hope that we're able to stop some bills that may limit vaccine access, for sure. Strengthen healthcare data and delivery. I think we've learned a lot about how important information numbers are when we try to, policymakers really try to plan for the pandemic and, in terms of preparing for the vaccine and clinics. And it's really important to have that data and be able to deliver that information. It's important to promote public health measures. We certainly have learned a lot over the last few years. New phrases like social distance and everything else. We finally at a point that I think we know what works, although it can change in any time, but we do know what keeps us safe. So promoting that, and then obviously supporting the long-term health of New Hampshire. So that's the overview of our campaign, and a number of the bills that we're looking at. Bobby, you can go to the next slide. Really have to do with, for the most part, countering most bills that we feel are really kind of an attack or leading us down the wrong path regarding public health and vaccine policies. I think with the COVID-19 pandemic, it's opened up a lot of discussions, not just related to the COVID-19 vaccine, but vaccines in general. And because we know that it's a proven public health measure, we do not want to lose ground on policies. So I'm just going to review very quickly some of the bills that we're watching. Obviously, the X means that we're opposing these. House Bill 1035 is relative to exemptions from school vaccine mandates. And this isn't just related to COVID. This is when we talk about all childhood vaccines that children need before they go to school or childcare. Polio, measles, mumps, these are all diseases that have basically been eradicated because of very strong policies with childhood vaccine initiatives. So what this bill would do is add a philosophical, personal, conscientious exemption. They've all been called different things. And that's very concerning to us. New Hampshire has a religious and medical exemption, but not a philosophical exemption. Traditionally, what we see is once you open the door to these philosophical exemptions, then your rates of vaccination go down. New Hampshire has very high rates. I think we're third in the nation. So we do not want to see that roll backwards. House Bill 1210 is really the same thing, except that applies to all employers, private employers, colleges and universities. It also would require a conscientious exemption, and then also prohibit an employer from requiring vaccines or any medical treatment approved by FDA for only emergency or experimental use. We've seen a few bills like this, and we are concerned about the impact that would have to our businesses and healthcare providers in particular. House Bill 1606 would make the state vaccine registry an opt-in program. The vaccine registry is a really critical tool when we talk about increasing vaccination rates and combating infectious disease. New Hampshire was the last state to have an immunization registry, so we're a little bit behind the game as to begin with. But by forcing individuals to opt in as opposed to opt out, really the data would become useless, and that's not what we want. We need this data. House Bill 255 has been put on the back burner for right now. It was tabled. It was a bill that was heard last year and then amended. And so when the legislature met in the beginning of January to vote on retained bills, this one was tabled. This is similar to the previous one of House Bill 1210. If it is not pulled off the table, then it will end up dying the session, I believe, if it's not pulled up by March. And then there are two Senate bills that we're looking at very closely. Senate Bill 288, which prohibits requiring the COVID-19 vaccination for schools and childcares. We just feel like this adversely impacts the childcare market in particular, and just really limits both access for families and just having that ability, if another tool in the toolbox, if providers need to go in that direction, or schools. And then SB 374, relative to the SARS vaccination, prohibits a person from requiring an individual who had COVID-19 or who is under the age of 18. I'm glad that Clarence likes this bill, receive a vaccination against the virus as a condition of employment, education, or access to business. So as you can see, these are all bills that really have a negative impact to New Hampshire's public health infrastructure. We hope you can join us in either testifying or signing in opposed in these bills. I will say House Bill 1210 is this Thursday, and we do know that House Bill 1035 has been scheduled for February 7th. Please watch out for our action alerts, and if you want to get more involved, please let us know. So that is the summary of our campaign for a healthy New Hampshire. Okay, and then as we move into the typical area that I work in, and Jake Berry and I, is access to treatment and alcohol and other drugs, kind of the foundation of New Future's work from the beginning days. And so the first couple bills are Jake. Jake, I'll let you address them and introduce yourself.
Thank you very much, Kate. We appreciate it. As Kate mentioned, my name is Jake Berry. I'm the Vice President of Policy here at New Futures. And as you heard, I'm here with my dog, Clarence, who has very strong views about many of these bills. So I apologize for that. As Kate mentioned, there are a few bills under our access to treatment and alcohol and other drug portfolios that we will be watching with great interest throughout this session. I'm going to touch on a few that impact our substance use and mental health treatment service delivery systems and so on. So the bill I want to start with is House Bill 503 relative to telehealth and medically assisted treatment for substance use disorder. As many of you know, medication-assisted treatment is a form of treatment for substance use disorder, more specifically opioid use disorder. Medications are better known as buprenorphine, methadone, naltrexone. Current law requires that patients take part in an in-person consultation before these medications are prescribed over telemedicine. Earlier in the COVID-19 pandemic, this requirement was waived under an emergency order, but now that the emergency order has come to an end, the requirement for the in-person consult is back in place, creating what we believe to be a significant obstacle or hurdle to a lot of people who are in need of this critical treatment. HB 503 would remove this requirement and allow individuals to receive MAT without the in-person consult, which we think would go far to increasing access. The second bill I want to touch on is House Bill 1622 relative to mental health parity. As many of you know, federal parity law requires that insurers cover mental health and substance use treatment the same way that they cover physical health. This means that insurers must cover the same number of visits and have the same co-pays and other out-of-pocket costs, among other provisions. This parity requirement has been in place since 2009 with the passage of the Affordable Care Act, yet enforcing parity law still remains one of the greatest obstacles our state faces in overcoming the ongoing addiction and mental health crises. So as proposed, House Bill 1622 would strengthen the insurance department's enforcement of parity law. It would make the annual reports filed by insurers available to the public in a way that they are not currently, and would further establish a process for appeal and review in cases where parity is in question. So there was a hearing held last week on House Bill 1622 in the House Commerce Committee, and they will be deliberating on that going forward. House Bill 503, the MAT bill was retained from last session. We were glad to see it pass the Senate early this session with strong bipartisan support, and will now move over to the House for consideration. So with that, Kate, do you want to go over some of the AOD bills?
Yeah, sure. The three other priority bills that we're watching regarding alcohol and other drugs is House Bill 1591, and that would eliminate the Enforcement Division of the Liquor Commission. That would jeopardize safe operation of licensed vaping and alcohol establishments by eliminating the Enforcement Division. They really are a key partner in prevention and work with many prevention organizations to really reduce substance misuse in communities. So that bill had a hearing last week. It is now up to the committee to make a recommendation, but we are opposed to that bill. House Bill 598, and the name's a little deceiving. It does commercialize marijuana and cannabis and sets up a regulatory market. We have developed principles this year that if the state chooses to go in the direction of commercialization policy, it really must utilize best available scientific evidence to reduce public harm, limit youth and problematic use, and advance social justice and equity in the state. There is a link to our principles in this document, but when you measure this bill, House 1598, it does not come close to meeting those principles, so therefore we oppose it. Senate Bill 275 relative to the Opiate Abatement Trust Fund is something that we do support. It's a Senate bill that had a hearing a few weeks ago. Senator Rosenwald did introduce this bill. The Opiate Abatement Trust Fund was set up a few years ago to ensure that the money received into the state from opiate legal settlements would only go to abate the problematic issues we've had with opiate over the years and really go to the communities. Right now, the trust fund is able to fund programs having to do with treatment and recovery, but not prevention. So what this does, as a few other housekeeping issues, is adds prevention as something that can be funded by these funds in the future. And that is it for our area.
Hi, everyone. I'm Emma Savini. I'm the Children's Behavioral Health Policy Coordinator here at New Futures. This session, we're following 4 bills as priority bills. First is House Bill 1531, which modifies the Oversight Commission on Children's Services. This bill does a bunch of things that are really great to improve the lives of children in our state. The Oversight Commission on Children's Services focuses on overseeing various state agencies and the Office of the Child Advocate. And this bill is timely in that it expands the membership on the commission to include more diversity, and also includes various provisions to expand the scope of the commission. And we think that this will improve the lives of children by improving those offices that help provide services for children. Next up is Senate Bill 416 relative to behavioral health assessments and treatment for children in out-of-home placements. Occasionally, it's unavoidable that some children do need to be placed in out-of-home treatment facilities when their behavioral health is such that it warrants that type of treatment. This bill would increase the types of assessments that those children go through before they are placed in these types of treatment facilities to ensure that their treatment is more tailored to what their needs are, in hopes that their treatment is more efficient and they can return to their community in a faster and healthier way. House Bill 1639, we oppose this session. This is relative to the Youth Risk Behavior Survey in schools. Currently, the Youth Risk Behavior Survey works to collect data among high school students to better inform various prevention programs and safety and wellness programs in the state. It is currently an opt-in or an opt-out survey, so everyone is presumed to participate unless a parent specifically opts their child out from participation. This bill would create an opt-in survey so that parents and children would have to opt in order to participate, which would reduce participation, reduce the data that we're able to collect, and our programming would not be as tailored to what the needs of certain communities are. So for those reasons, we oppose House Bill 1639. And then finally, Senate Bill 444 is relative to the Childhood Adverse Experiences Treatment and Prevention. Childhood adverse experiences, commonly referred to as ACEs, are traumatic experiences for children that can have lifelong consequences. What this bill does is build out the infrastructure of the system of care to better provide services for these children who have experienced ACEs, to better mitigate those long-lasting damaging consequences of this. For instance, it would create a large financial distribution for child parent psychotherapy, which is an evidence-based practice to help unify a family who has gone through a traumatic experience. Go to the next slide.
Hi, I'm Rebecca Blakowski. I'm the Kids Count Policy Director here at New Futures. And today I'm going to go over and highlight some really important early childhood bills. Just to note, this is not an exhaustive list, but these are some priorities that New Futures is tracking this legislative session. So first up, we have Senate Bill 144. This is a retained bill. This bill aims to create a pilot program that would change our child care scholarship program to be enrollment-based rather than attendance-based. We know, because this was piloted during the Safer at Home orders, that this is a really good policy change for both providers and parents. It creates predictability. So we're supporting this bill. Senate Bill 407 is relative to expanding Medicaid to include certain postpartum healthcare services. So what does that mean? So this bill aims to increase Medicaid coverage for participants for 12 months. Currently, Medicaid participants lose their coverage after 60 days after birth. But we know that the first year is really vulnerable for both moms and babies. So having continuous coverage for 12 months improves health outcomes for both moms and babies. So this is an essential change to support maternal and child health and to prevent maternal mortality. House Bill 1536, which is not listed, is the parallel bill to the Senate bill that we are also supporting. Senate Bill 446, establishing a childcare workforce fund and grant program. So this bill increases access to childcare by creating a grant program to support centers in recruitment and retaining of childcare workers. We support policy efforts which aim to help the childcare workforce. This bill has a hearing on Thursday, January 27th at 10:15 in Senate Health and Human Services. So if you're interested in lending your support for this bill, please attend. Senate Bill 453 is relative to statewide pre-kindergarten funding. This bill really supports children and working families by requiring public school districts to provide pre-kindergarten or pre-K programs. We know access to pre-K is important not only for academic success, but also because it helps mitigate the impacts of early childhood trauma. Statewide funded pre-K is a really important step for our New Hampshire's early childhood system. Senate Bill 326 is relative to an Office of Early Childhood. This bill is a really important infrastructure change that is aligned with the work of the Council for Thriving Children. It helps to build a more coordinated system to support the birth through 8 system for kids and families. Two bills that aren't listed, but I just want to note, are Senate Bill 403, which reestablishes a WIC farmers market benefit for participants, and Senate Bill 404, which establishes a SNAP outreach program. So 2 bills around food insecurity that are really important that both have hearings this week. Thank you. Next slide. Jake, you're muted.
Thank you very much, Rebecca. I appreciate that. It wouldn't be a webinar if one of us stayed on mute, right? So to finish us up, I did want to go over a number of priority bills under our health portfolio. As many of you know, one of the issue areas that New Futures works under is trying to increase access to affordable and quality health care. So with that in mind, we are following House Bill 103, which would establish a dental benefit under the state Medicaid program. We all know that dental care and oral health are critical components of overall health and wellness. The state has been working for several years to expand its Medicaid program to cover dental care, and thankfully, finally, this bill does appear to be moving forward. House Bill 103 was retained from last session. And so they looked at it over between sessions, and I'm proud to say that early in January, when the House of Representatives reconvened, they did vote to support House Bill 103 by a strong bipartisan margin. And so now that initial vote is out of the way, we'll be moving on to the House Finance Committee for further review. That's something we look forward to continuing to support and help usher across the finish line. House, next up, we have Senate Bill 399 and Senate Bill 434. We paired these 2 bills together in our presentation as they are very similar in topic. And they both are proposing to repeal the 24-week abortion ban and the associated invasive ultrasound requirement that was put in place in last year's budget. We all know that the reproductive health care, again, is just a critical component to healthcare. We believe that the abortion, the 24-week abortion ban and the ultrasound mandate are really intrusive and really denying service to women and families that need it. So both of those bills were put to hearing last week in the Senate Health and Human Services Committee, or no, I'm sorry, Senate Judiciary Committee, and will be going to a vote in that committee soon. House Bill 1028 relative to the form of individual health insurance policies. This is a bill that refers to so-called skinny plans, short-term, low-coverage insurance plans that are on the market. This would allow these plans to be renewed in an unlimited way, that they would allow them to be considered more full-time plans and not the short-term plans that they were initially intended. We believe this really diminishes the quality and affordability of healthcare and leaves people with significantly higher bills and less coverage. So we are strongly in opposition to that bill. And lastly, we have House Bill 1526 relative to income eligibility for in and out medical assistance. The state's in and out medical assistance program is intended to provide coverage to individuals who qualify for Medicaid in every way, but do not apply to the income limits. This would raise the income limits on the in and out program, which would allow more people to access the program, provide greater levels of financial stability and predictability, and just greater health coverage. So we sit strongly in favor of that. There's a hearing on that bill tomorrow in the House Health and Human Services Committee, and we look forward to supporting it. So with that, that brings us to the, I'm sorry, next slide, please. That brings us nearly to the end of our presentation here. There are two bills that we are following that we believe have heavy impacts on just equity and diversity, equity and inclusion in our state. There's Senate Bill 304 that would repeal the so-called ban on discussion of divisive concepts that passed last year, included in the budget. As you all know, I'm sure the budget did include language that restricted teaching and training on issues related to race, gender, and other so-called divisive concepts. This would repeal that ban on those discussions, Senate Bill 304, which we think is just even critical to the health and wellness of our state. And lastly, there's House Bill 1313 relative to freedom from discrimination in higher education. Despite what the title says, this bill would extend that ban on teaching and training of divisive concepts to public colleges and universities, which again, we think really just stifles discussion and limits our ability to overcome the inequities that we face as a state. So we stand strongly in opposition to that bill. The last bill that I do want to mention that is not on our PowerPoint here, but we think is critical to all of these issues we have discussed today and so many others, is House Bill 1014. It's up for hearing on Thursday. This bill would allow public bodies, both at the state and the municipal level, to choose to meet remotely and to allow individuals to participate in these meetings remotely from their homes. We know that last year and the year prior, after the COVID-19 pandemic set in, the legislature moved, like so many other public bodies, moved to remote meetings and enabled a Zoom option to allow people to testify and make their voices heard from home, from outside the legislature, where they could stay safe and healthy. That really expanded the public process, the legislative process, to thousands of people who were traditionally not able to participate, not able to make it to the State House during daytime hours to testify. Sadly, with the end of the public emergency, that Zoom option went away, and now the legislature has reconvened hearings in person. And though they are live streaming their sessions, allowing people to watch from home, individuals are not advocates, are not able to participate or make their voices heard from home, and have to risk their health and safety by attending hearings in person to make their voices heard. So this bill would again clarify that public bodies have the authority to conduct virtual meetings and to enable virtual participation. So we are strongly in support of that, House Bill 1014, and that hearing is Thursday morning. So with that, I think that brings us to the end of our discussion today. There are many, many other bills that we are following and weighing in on, but those are some of the priorities that we have highlighted. As always, we would so appreciate your support and your engagement on these issues. For anybody who is willing or interested, we would love to work with you in any way to make your voices heard on these critical issues. I don't see any questions in the chat. Anyone, please feel free to type them in if you have any. And if not, we will close up shop a little bit early today. Thank you again for your support. Thank you for your engagement, and we look forward to working with you throughout this session.